So today I am going to present on lichen planus. So lichen planus, what's the meaning of lichen planus? It is derived from two words, lichen and planus. Lichen means tree moss and planus means fat. So people resemble it as a skin lesion which is flat and appears like a tree moss. So it is a rare chronic inflammatory immune mediated disorder and it occurs in adults. So what are the triggers of this lichen planus? The people who have dental amalgam are more prone to develop lichen planus. Amalgam is an alloy of mercury which increases the risk of lichen planus. It is also present in people who have hepatitis C and B and the people who are on anti-malarial treatment.
Okay.
So what are the symptoms of this lichen planus?
Oh, we have stopped. Yes,
No, it's okay. It's okay. So in lichen planus, the skin lesions are pruritic as compared with erythema nodosum. In erythema nodosum, the skin lesions are not pruritic, and in erythema nodosum, the lesions are also painful. Often, the most commonly we have lesions on the we have oral lesions, and they are often asymptomatic, but we can have burning sensation if we eat something spicy. The lesions are purple and polygonal. They are present on the inner side of the forearm, wrist, and ankles. They can also present as painful sores in the mouth or genitals, and they have also nail and hair involvement. We will see this involvement in the upcoming slides. So what's the morphology? We can know it by 6 P's, which is purple, polygonal, pruritic, papules are present, planar, and plaques. Often there is mucosal involvement. Mucosa is the innermost layer of the skin. So the organs like mouth, tongue, and Lange penis are involved. So now in this we can see that there are lymphocytes at the dermo-epidermal junction. Hyperkeratosis, that is inflammation of the spinous corneum, and hypergranulosis, that is inflammation of the spinous granulosum. And we can see the sawtooth. We can see sawtooth appearance of reticulus here. They are the portions of epidermis which lead down into the dermis. And what is the pathophysiology of lichen planus? There are certain allergens in the environment or certain drug reactions which trigger an immune response, and the basal keratinocytes are expressed in the body, which is followed by inflammation, and it is triggered by T cells. It leads to the T cells activate cytokines and mast cells, which lead to lichenoid reaction. Now there can be mucosal lichen planus and cutaneous lichen planus. Mucosal lichen planus can cause bullous lesions like fluid-filled vesicles or papular or plaque-like lesions, and cutaneous lichen planus can have the morphology like 6 P's of lichen planus and Whiteham striae. Now what are Whiteham striae?
And we also have third form.
Yes, I have mentioned.
Okay.
So what are Whiteham striae? They are the white lines which are present in the regions of lichen planus. You can see the white lines here, the oral mucosa. Then Kobler's phenomenon. It is the appearance of new lesions. It is the appearance of new lesions on and previously unaffected skin, secondary to any trauma. Now here is the dermoscopic image of of a light skin and dark skin.
Yes.
On the light skin you can see white lines against a pink background, and on the dark skin you can see blue-gray lines against a brown background. Now, reticulate lacy white pattern means that on the oral mucosa you can see a net-like pattern. Then there is nail involvement. So you can see thinning of the nail plate in the first image. So and in the second image there is pterygium of the nail. So what is pterygium of the nail? It is something which extends from the nail fold. It destroys the nail plate and reaches until the nail bed. It appears as wing shape or tent shape. Then anonica, there is absence of the nail and perm tent side, which you can see here. Okay, so you can see purple lesions here. They are polyangular. They have many angles. On the
remember,
wrist.
this is classic picture. This is absolutely classic picture. What you need to know. Okay.
And also there are oil accentuated lesions. We can see some oil accentuated lesions there.
Sometimes we need this oil to see we chemistry. Yes, this is better.
Yes,
better visible when you apply.
Yes,
Okay.
the becomes here visible. Now this is hypertrophic lichen planus present on the lower legs. This is generalized.
Sometimes cryotherapy will have this hypertrophic lesions.
And this is generalized lichen planus. So this image is of a patient who developed lichen planus after taking anti-malarial drug. We can see the absence of papillae on the tongue and vicum striae on the tongue. Then there is also the penis is involved, lichen planus on penis, and in vagina there is erosion of the vagina and the whole vaginal tract is involved here. So now I will talk about lichen planopilaris. It is a hair manifestation of lichen planus. So there is scaling alopecia. It is loss of hair is present, and perifollicular blue-gray hue is present. So there is how does it occur? There is hyperkeratosis, that is inflammation of the corneum, corneum, and hypergranulosis, inflammation of the wedge-shaped hypergranulosis of the stratum granulosum, and yes, and stratum spinosum is also inflamed, which is known as acanthosis. There are necrotic colloid or seaweed bodies which is present in lichen planopilaris. As I mentioned earlier, there is saw toothing of the retail edges, and there is one artifactual plaque present in the dermal epidermal junction, which is known as the Max Joseph space, and there are band-like lymphocytic infiltrates present in the dermal epidermal junction, and there is basal cell degeneration. So how can we diagnose this lichen planus? We can do one allergy test which can flare up the lesions of lichen planus. Biopsy can also be performed by taking a scratch of the lichen planus, and we can also do blood test to check for hepatitis C, because it is mostly associated with hepatitis C. And
okay, everyone remember that?
And the 6 P's, which are polygonal, pleuritic, purple, papules, and plaques. Treatment. So we can give immunosuppressants like mycophenolate, mofetil, corticosteroids, azathioprine, cyclosporine. Antihistamines are used to reduce the allergic symptoms. Then phototherapy. In phototherapy, ultraviolet V light is given because it reduces the lichen planus rashes and also many other rashes in other lesions. Retinoids contain vitamin A, which increases the collagen in the body, and it also increases the blood vessels. Then aloe vera. Then other treatments which can be used is aloe vera. Oatmeal contains gluten, which can help to cure this, and these are my doctor.
Thank you.
Thank you.